LeadingAge Ohio Advocacy Issues. Regulatory restraints. The complexities of Medicaid and Medicare. Waiver programs, public housing, publicly funded programs. LeadingAge Ohio members must comply with layers of senior service requirements and restrictions. It is to be expected, then, that LeadingAge Ohio members continually seek advocacy support. To that end, LeadingAge Ohio's member volunteer leadership has identified specific public policy priorities. At the top of these priorities is preserving funding for senior services. With a large amount of public dollars expended supporting services offered by LeadingAge Ohio members, funding is the #1 focus. Recognizing the recent economic turmoil that has rocked the country and the state of Ohio, LeadingAge Ohio and its members are acutely aware of the need to provide cost-effective solutions for all publicly funded programs. Medicaid, in particular, is a focal point, as this program accounts for 16% of the total state budget and incorporates federal dollars. LeadingAge Ohio advocates for a Medicaid reimbursement system focused on measurable quality outcomes that would ensure that state taxpayers receive the greatest value possible in housing and health care services for older and disabled Ohioans. This reimbursement system, which provides support for senior service providers, must also incorporate geographical differences for the cost of doing business and capital investment for building maintenance and renovation. The state's Passport program is the primary funding source of home and community-based services. Reimbursement to Passport service providers has been stagnant for over a decade, falling behind inflationary costs. Passport and Medicaid waiver programs are currently offered by many LeadingAge Ohio members at a loss as part of their commitment to offering continuum of care services. However, if public policy is going to dictate greater utilization of home and community-based services, then provider reimbursement levels need to incorporate inflation factors. Likewise, federal senior housing programs must be funded to better meet the influx of older adults and the increasing emphasis on providing quality housing and supportive services in independent settings. While debate in recent years has focused on reining in publicly funded programs, the cost of regulatory compliance continues to climb for senior service providers. This is especially true for LeadingAge Ohio members who must navigate various state and federal agencies. Regulatory red tape inhibits many members from offering innovative housing and health care models that would increase consumer satisfaction with streamlined delivery systems. In order for service providers to meet the needs of an aging population with quality and flexibility, regulatory relief at the state and federal level is critical. LeadingAge Ohio has position statements available on issues impacting members and those they serve. These position papers describe underlying issues and offer recommendations for ensuring that older and disabled Ohioans receive quality housing and health care services in the most appropriate setting possible. To access these position papers and other LeadingAge Ohio advocacy material, please visit www.leadingageohio.org and click the Advocacy button in the Member Services column. Along with the position papers, you will find additional material describing how anyone can be an advocate for quality senior services.